So it's my pleasure to introduce Professor Megan Best to ICMDA webinars. I've known Megan for many years and ICMDA connections mainly, and this talk is going to cover the current place of assisted reproductive technologies in our social landscape and the ethical challenges that they represent for Christians. Megan Best, PhD and BMed. She's got over 30 years of experience in palliative care and medical ethics teaching, research and practice. And she's currently an associate professor in bioethics at the Institute for Ethics and Society at the University of Notre Dame in Australia. And her research is focused on spirituality and healthcare, ethics at the beginning and end of life, and psycho-oncology. She's written extensively on medical ethics and has published 2 books on ethics at the beginning of life. That's Fearfully and Wonderfully Made, Ethics in the Beginning of Human Life in 2012, and A Life Already Started a year later. And throughout her career, Megan has engaged with evidence-based health policy development and made important contributions to health legislation in Australia. So Megan, it's our pleasure to have you on ICMDA webinars, and we look forward to you on ethics of in vitro fertilisation. Thank you.
Well, thank you very much for this opportunity to speak today. I'd especially like to thank the interpreters who are making the talk available to a wider audience. And today we'll be looking at the ethics of in vitro fertilisation, or IVF. IVF is legal in most countries in the world, but just because something is legal doesn't mean it's ethically permissible for Christians. Today I'll be discussing IVF from a Christian perspective. Christians have an ethical compass, which is the Bible, and I'll look to biblical standards as I speak today. I'll start by discussing the social factors that have led to the high demand for IVF before considering the ethical issues it raises. Finally, I'll discuss the approach I recommend for Christians. Fertility is a painful problem, and I have great sympathy for those in the audience that experience it. We can get some sense of the pain and desperation felt by those involved, by the efforts they make to overcome their problem, the time and money spent, and the stress and pain of fertility treatment that they're willing to endure. The Bible validates this pain by the verse shown here, which compares the emotional pain of infertility with insatiable natural phenomena. This alone can explain why the demands for IVF are so high. But the presence of infertility alone doesn't explain the high and increasing rates of IVF use. It's thought that in the last 40 years, more than 8 million babies have been born through IVF across the world. IVF births represent 1 to 2% of all births in the USA. In the UK, it's close to 3%. And in Australia and New Zealand, it's over 4%. This equates to 1 in 20 Australian children, 1 in every classroom. So why is it so common? Well, infertility is on the rise. Female infertility is impacted by couples in Western countries delaying starting their families till later in life, often until after 35 years of age for women. They wait until their careers are established and they're financially stable. Newspaper reports of celebrities conceiving after the age of 35 years have perpetuated the myth that childbearing can be delayed, but in fact, female fertility starts to reduce at the age of 27 years. The social phenomenon of multiple sexual partners and the consequent transmission of infectious disease has contributed to pelvic inflammatory disease and other problems that can damage the reproductive system. There's also an international decline in male fertility, with one study reporting that sperm counts have fallen by 60% over the past 5 decades. There are reduced opportunities for adoption, largely due to the rise in elective abortion. And there's also a rising desire for a biological child, which in many cases is a desire which has been created by the availability of IVF. The increasing repertoire of assisted reproduction is making a biological child a possibility for people who previously wouldn't have even contemplated it. For example, couples who experience social infertility because they're single or in a homosexual relationship, or where a wife is past menopause. Some groups lobby for availability of IVF on grounds that there's a right to a biological child, which governments should support. But it's difficult to see on what grounds such a right could exist. The physical impossibility for some people to bear a child means it cannot be a right. While the United Nations Declaration of Human Rights protects the right to marry and have a family, the relevant laws involve negative rights, preventing interference by the state, rather than positive rights, obliging the state to assist the infertile with all available treatments. For this reason, IVF is often available only if the couple can afford the treatment on grounds of it not being essential healthcare. But in order to understand the ethics of medical interventions, we need to be clear on the science. So let us take a moment to remind ourselves of the basics of embryology. Human conception begins with fertilization of an egg by a sperm, which creates a single cell called a zygote. This is a highly magnified view of a sperm burrowing into an egg. And from this point, development is a continuum through pregnancy and childhood to adulthood. And all the genetic material, or DNA, required for full maturity of the human being is present in this first cell. So in this one cell, we have a member of the species Homo sapiens. Cell organization begins immediately, even before the genome is activated. Research has shown that the point where the sperm enters the egg decides the orientation for how the embryo will be structured. This means that right from the time the sperm enters the egg, it's an organized being. First cell division occurs within 24 hours of fertilization, and cellular division continues while the embryo travels down the fallopian tube towards the uterus. An embryo is pictured here at the 16 cell stage, with different types of tissue shown by the different colors. Tissue types correlate with what will become the embryo and the placenta. Day 5 or 6, we have a blastocyst. This is where the stem cells come from. And at the end of the first week, implantation begins, where the embryo attaches to the uterine wall and the mother's blood supply starts to nourish it. Then we can see continued development. At 7 weeks, all essential organs have begun to develop. And you can see that even while still at the embryo stage, an enormous amount of development has already taken place. At 3 months, we stop calling it an embryo and start calling it a fetus. And at 3 months, the fetus reaches just over 8 centimeters in length. The face and body are formed and now just need to mature for the remainder of the pregnancy, which we can see here, until birth. Now, I don't think that many people would disagree that a newborn baby is a human being who deserves care. So my question is, if this is a human, when did it stop being a human? Any embryology textbook will tell you that there is no doubt in biological terms that we're dealing with a human being from the time of fertilization. The embryo, from the time it's created, is a unique, unified, dynamic, self-directed whole, not just a collection of cells. Embryologists, the specialists in the science of the development of the human embryo, agree that there is no doubt in biological terms that we're dealing with a human being from the time of fertilization. This is a quote from a leading embryology textbook. It says, although life is a continuous process, fertilization is a critical landmark because under ordinary circumstances, a new genetically distinct human organism is formed when the chromosomes of the male and female pronuclei blend in the egg. This remains true even though the embryonic genome is not actually activated until 2 to 8 cells are present at about 2 to 3 days. During the embryonic period proper, milestones include fertilization, activation of the embryonic genome, implantation, and the appearance of the primitive streak. Despite the various embryological milestones, however, development is a continuous rather than a stepwise process, and hence the selection of prenatal events would seem to be largely arbitrary. What they say is that as everything it needed to grow was present from the first cell, and it directed its own development since then, it would be arbitrary to say that human life began at any time after fertilization. So biologically, when the sperm and egg joined, human life began. This is not even vaguely controversial in scientific terms. But if there's no doubt biologically that the human embryo is just that, human, how is its wanton destruction justified? Well, the answer lies in the philosophical definition. Traditionally, it was believed that what made humans different from animals was the ability to reason, to be able to think things through. A human person was someone who could reason. Therefore, it was considered that all human beings were human persons. This is certainly the view that has been held for most of human history. Until recently, it would have been inconceivable to suggest that a human being was not a human person. The definition of personhood underwent a change last century when political expediency intervened. In 1954, Joseph Fletcher, who was fighting to legalize abortion, published a book to argue that unborn humans weren't human persons. Obviously, if the embryo was not a human person, then abortion would be much easier to justify. Fletcher wrote that the human person must not merely have the potential to reason, but be able to exercise it at the time. This wasn't based on any scientific discovery. It was just driven by the political debate around abortion. Fletcher went on to argue that if the human embryo is not a human person, then it doesn't merit legal protection. Using this argument, protagonists of IVF have suggested that protection is only due to human persons and that personhood is not achieved merely on biological grounds. Modern philosophers have proposed many different points at which personhood begins, or when independent moral status is acquired. You can see some of them here on the slide. This would indicate when legal protection is deserved, according to these philosophers. Generally, these theories require the unborn child to have particular features or abilities before being considered worthy of protection. And notice some of these requirements are not even intrinsic qualities of the fetus. For example, viability can depend on the level of technology available at the time of birth. And what does the Bible say about when life begins? Well, we can learn a lot about the way God wants us to treat humans by considering the way we've been made. Human beings have been uniquely made in the image and likeness of God. We are valuable because of Him. It's not dependent on what we can do. In contrast to the modern philosophical view that personhood must be earned, the Bible teaches that our personhood is inherent. It's inbuilt because of the nature of the God whose image we reflect. We are to treat all human beings with respect for the whole of their lives, regardless of their particular characteristics. It is not our respect that gives them dignity. Rather, it's because they have innate dignity that we owe them respect. But when does it begin, the life of a human being? Well, there's no key verse in the Bible which tells us exactly when life begins. The Bible isn't a scientific textbook, but human life certainly begins before birth. The Bible makes the link between conception and birth in many places, such as Genesis 4, when Adam lay with his wife Eve, and she became pregnant and gave birth to Cain. The incarnation is a powerful reminder of the status embryos hold in the eyes of God. In order for him to take on true humanity, Christ had to commence life as an embryo rather than as a fully functioning human. The Bible describes the relationship we have with God when we're still in the womb, such as during our formation, and there are wonderful passages in Psalm 139 and Job 10. These are only a sample of the verses which illustrate these points. I addressed this topic in much more detail in my first book, Fearfully and Wonderfully Made. But there's no doubt that the unborn human is recognized in the Bible as one who is capable of a relationship with God. Christians, therefore, need to be careful in how we treat every human embryo as one made in the image of God. So how do we approach IVF as Christians? I must be contacted at least a couple of times a month by Christian couples who have come across ethical problems due to IVF, and many of them are difficult to undo. I can't stress enough how important it is for Christian couples to stop and examine the ethical challenges before they start IVF treatment, as many of the problems can be avoided only if you're aware of them in advance. Furthermore, while I think it's possible to engage with IVF in an ethical way, it will usually mean doing things differently. While some IVF clinics are happy to accommodate those whose religious beliefs are opposed to some common practices, most clinics, in my experience, see distinctive requests as troublemaking. You may as well get used to it. You'll need to be proactive if you want to do things differently. Excuse me. Lastly, I think it's always important to let Christian couples know that they are not ethically obliged to access IVF, as the Bible doesn't teach anywhere that we're obliged to use all means available to build a family. In my experience, this information is often received with relief. Human embryos were first created and grown in the laboratory as part of research which led to development of IVF. Louise Brown, the first test tube baby, is the one you see in the photo here. She's a Brit. And IVF involves combining eggs and sperm in a petri dish in a laboratory in order to create embryos, which are then transferred to the uterus of the mother. The development of IVF and associated therapies has involved the destruction of large numbers of human embryos, and embryo destruction is ongoing as therapies continue to develop. Some of you might ask, how was this allowed by an ethics committee? Well, apart from the philosophical issues, there is another factor that's contributed to the manipulation of human embryos outside the body, and it's a change of definition of when human life begins. In 1972, the American College of Obstetricians and Gynecologists made a deliberate change in the definition of conception. This was done to help with marketing contraceptives. Instead of the accepted scientific view that conception was the result of the process of fertilization, they defined the time of conception as implantation, a week later. As a result, the link between fertilization and conception was broken, and this new definition is now found in medical textbooks. Note that embryologists, the experts in human development, never made this change, and embryology textbooks mark conception, or the beginning of human life, as starting at fertilization. However, on the basis of the new definition, many doctors don't consider human life to have started or to be morally significant until after implantation. Therefore, they don't see the destruction of human embryos created in the laboratory as problematic. There are many ethical challenges in using IVF, but I'll just mention those that I'm asked about most often. And I'd say the most common ethical problem encountered by Christian couples in IVF treatment is that of excess embryos. Success rates in assisted reproduction have always been low, less than 20% worldwide overall. It depends on many factors, such as the age of the mother. In attempts to improve success rates, clinics generally encourage couples to allow them to create as many embryos as possible after egg collection. Egg collection is an invasive and expensive procedure with the potential of serious side effects. You don't want to do it more than you have to. But obviously, the more times you place an embryo in the womb, the better the chance of a pregnancy developing. There is no formula to accurately predict how many embryos are needed to produce one live birth. Hence, many clinics suggest the more embryos, the better, just in case you need them. Infertile couples tend to be extremely vulnerable at the beginning of treatment and are understandably amenable to any suggestion which may improve chances. They're usually thinking only about their desire to have a baby. The thought they might have too many doesn't cross their minds. This can mean that the number of embryos created is much greater than the number of children the couple would ever want. I've known of cases where over 20 embryos were created for one couple. But the expectation is that not all embryos will end up as a live birth. Any embryos left over from the first treatment will be classified as low quality and discarded, or frozen for future use. Some embryos won't survive defrosting, and others may not develop once in a woman's womb. When the couple have the number of children they want or stop treatment for another reason, they may find that they have surplus embryos. These often represent an unforeseen ethical problem for the parents, and the number of excess frozen embryos in IVF clinics increases yet again. Excuse me. It's thought that there are hundreds of thousands of frozen excess human embryos around the world at this time. Some of these embryos will be donated for destructive research. The ongoing practice of IVF and associated therapies requires an ongoing supply of human embryos to facilitate further technological development, such as improvement of culture media, training of clinic staff, and quality control in laboratories. If we really believe we should protect human life from the time of fertilization, should we cooperate with an industry that normalizes embryo destruction? For this reason, some couples decide against IVF. While IVF has helped many couples to build a family, there are many more couples who have not benefited from treatment and have suffered physical, emotional, and financial problems without taking the longed-for baby home. Even now, more than 40 years after the first test tube baby was born, success rates in most places still rarely climb above that 20% per cycle. Some physical risks are known, such as the increased incidence of multiple pregnancy, but some are not, such as the long-term impact of ovulatory stimulation drugs. Emotional risks are linked to the monthly cycle of hopes raised with the embryo transfer, which are dashed if the pregnancy doesn't progress, known as the hope roller coaster. IVF tends to be expensive, which can cause financial distress. Christian couples need to consider whether the time, money, and stress invested in IVF are the most godly use of the resources God has given them. Often the decision to stop IVF treatment is harder than the one to start it. Some couples are unable to conceive because one partner doesn't have gametes, sperm or eggs. In this situation, gamete donation has developed to create embryos which are biologically related to the other parent. While the use of donor gametes may not be unethical per se for Christians, it's good to consider whether it's wise. Infertility should be viewed as a joint problem in Christian marriage. Men whose wife have carried a child conceived with another man's sperm have reported feelings of sexual jealousy, even if no physical infidelity has occurred. Anything that disrupts the unity of Christian marriage and the one flesh needs to be viewed with extreme caution. While sperm donation is straightforward and easily accessed, egg donation is more complex. It involves the use of ovarian stimulation drugs and potential health risks. Commercial egg donation across the world has been associated with coercion of financially vulnerable women, which is definitely unethical. With regard to the donor, gamete donation separates the donor from the responsibility of raising their child, which in the Bible is part of the role of the parent. A further ethical concern in some places is the anonymity of the gamete donor. Donor offspring have expressed confusion about their identity and want to know their biological heritage. They've lobbied across the world for the opportunity to access information. And in response, there are now donor registries in some countries to make this possible. New directions in IVF aim to control the characteristics of the embryo implanted through analysis of the embryo's genetic makeup. There is increasing pressure in both IVF clinics and society to subject all embryos to pre-implantation genetic diagnosis, or PGD, before implantation. In this procedure, a cell is taken from an embryo at the 8-cell stage and its genetic makeup is examined. PGD was originally used just to avoid serious illness, but it's increasingly used to identify a wide range of diseases, including diseases which are treatable, diseases which may not manifest until adulthood, such as some cardiac diseases and cancers, and diseases which are related to genetic risk rather than diagnosis in the case of incomplete penetration. Currently, we can screen for a lot more diseases than we can cure. So the expectation is that embryos that are identified to have unwanted genes are discarded, and only healthy embryos are transferred to the woman's uterus. With the increasing availability of whole genome sequencing, problems in this area are likely to increase. In many places, PGD is used to identify the sex of the child, and the embryos of the other sex, even if they're perfectly healthy, will be discarded because they're not the preferred sex of the parents. So how should Christians proceed? Well, I think the important questions a Christian couple should ask before beginning IVF are the following. What is involved? Get the facts. Will the specialist respect your theological views? Will the number of embryos created be limited? This number should not be higher than the number of children you're willing to raise. What is the cost and how can you afford it? How important is it to you to have a biological child? And perhaps, how will you decide when to stop treatment? This is a brief overview of some of the ethical issues in IVF for Christians. If you'd like to read more about these topics, please see my first book, Fearfully and Wonderfully Made, where I discuss these issues at length. It's available on Amazon and at good Christian bookstores. I'm happy now to take questions. Thank you for listening.
Thank you very much and well done. We've been listening to Associate Professor Megan Best from Notre Dame University in Australia, speaking to us on the ethics of in vitro fertilisation. We've now got time for question and answer. So let's go to the questions, and thanks very much, Professor Best, for setting the context really well, looking at the reasons for the increasing demand for these technologies, and also taking us to the fundamental questions about the status of the human embryo, both from a philosophical and biblical point of view. Now, our first question is around the issue of donor eggs and sperm. And you've hinted, first of all, in saying that it's not technically adultery in the sense that there's not the physical infidelity element or the lust or cheating elements of adultery, but nonetheless it does involve introducing a third person into the equation, if you like. And yet this is a very common procedure now. If either there is a sperm or egg failure, or sometimes people just by choice will not be using their own eggs and sperm, wanting to introduce someone else. So can you just comment again on your view on donor eggs and sperm? Is this an option for Christian couples looking at this, or is this something that they should be much more wary of and avoiding?
Thank you for the question. As I said in the talk, I can't see any direct biblical prohibition to donor gametes per se, but if you think about the one flesh in the marriage relationship, the donor gamete does, even if it's not in a physical sense, it does bring an extra person into that, the relationship generating offspring. And my main concerns are to the impact it can have on the marriage relationship, and rather than seeing infertility as a problem of the marriage, it's seen as a problem of one of the partners, and it's addressed by using donated gametes. And I really, when you think about the imbalance, then it can also cause in the parenting, where one parent is aware that they're not biologically related to the child. There are just imbalances in the relationship that persist. Then we also have the problems expressed by the donor offspring, that it causes identity confusion for them. These problems have only fairly recently been identified, because we had to wait till donor offspring got to the age where they were old enough to be aware of identity issues, to be able to express them. But certainly there are large numbers of donor offspring who campaign against donor gametes. And I think we need to take notice of this. I don't oppose the use of donated embryos. I think donated embryos doesn't cause that imbalance in the marriage relationship. And I'm totally in favor of that as what we call a retrieval ethic, in that in a fallen world where we wouldn't want to have any excess embryos if we could avoid it. But the fact is there are lots of excess embryos, that donor embryos allow us to address that situation where there's some embryos without a home, and it doesn't cause any imbalance in the marriage relationship. It doesn't damage the one flesh, and I think you can think of it as a very early adoption. But it's really the damage to the marriage relationship I'm most concerned about in the situation with donor gametes.
Yes, and you make that point very forcefully, that there's a difference between a donor gamete on the one hand, which introduces a third person, and embryo donation, which is much more akin to early adoption. There's a program called Snowflakes in the US, where where people can actually adopt new embryos that have been frozen. So, but the Snowflakes program, which enables early adoption to take place, and you alluded to some programs producing up to about 20 embryos at a time. But can I ask you also just about the whole principle of freezing an embryo, and should we be creating excess embryos? What does freezing do to the embryo? Can it damage it or create other issues? Should we only be producing enough embryos that are going to be implanted at that time? That's a question many people agonize over.
It's an interesting philosophical question, whether we should freeze embryos, because we don't usually freeze people. It's a developing area of knowledge, but it does seem that if you freeze, some people say we shouldn't freeze embryos because it increases embryo wastage, because some embryos don't survive defrosting. Some of the defrosted embryos won't develop once they've been transferred to the uterus. But there's growing evidence that, in fact, we know that maybe 50% or more of those embryos wouldn't develop anyway, and that really what's happening when we freeze, say, freeze an embryo at the 2 to 3 day stage, and then we have problems progressing growth once it's been defrosted, that in fact it's a self-selection mechanism, that those cells, those embryos that don't survive the freezing process wouldn't have survived anyway. And what we're really seeing is just sorting out which of the embryos that are more robust genetically and which ones are less robust. And that in fact, there isn't any overall wastage with freezing embryos. However, I think that if we didn't freeze embryos, we wouldn't have this problem of all the excess frozen embryos. And with recent improvements in egg freezing or egg vitrification, I think that the technology for us to freeze eggs and sperm are much more viable options now. And there's no moral status in a gamete. Gametes alone, and an egg or a sperm alone, don't have moral significance, and it doesn't really matter what happens to them. So if the issue is, because it's difficult and expensive and risky to harvest eggs, that's something we don't want to do very often. So you could do the harvest and then freeze those eggs and just create embryos as you want them. And I think that's really what we need to aim for.
Question from Claudia Stein here. She's saying, how many fertility clinics allow couples to have only as many embryos as they'd like to implant? Is there a problem with that when we attempt to negotiate with them? Does some just refuse to go ahead anyway? Yeah. In
my experience, it's definitely a problem, because in most areas, IVF clinics want to advertise their success rates, and they will have more chance of success if you have more embryos. They don't want to run out of embryos. So they will encourage you to have more embryos rather than less. And I've known of couples who have been quite explicit throughout the process, saying we only want 3, 4, 5 embryos created. And then their wishes have been even overruled, or the embryologist didn't believe they really meant that and made more anyway. So it's something you have to be very clear about in advance and keep repeating every time you engage with the clinic. It's definitely something which clinics resist, because they're happy to make as many embryos as they like and just discard some of the ones they don't like the look of. But if you do value every embryo and want to give them all a chance of life by transfer to a uterus, you will need to fight for your embryos, definitely.
How much of this excess embryo production is driven by the desire to produce embryos for research? It's said that often a lot more embryos are produced for experimentation or research.
I really hope it's not the case, but how will we ever know? If people have excess embryos, certainly a lot of people will donate the excess embryos for destructive embryo research. That's one of the options they'll be given. But because selection of embryos once they're made is based on morphology, and morphology is not a reliable way in the early stages, pre-blastocyst, of working out which are the most likely to survive in my research. What happens to those embryos that the clinic just says, oh, we've just frozen the best ones for you? Well, what happens to the rest of them? In some places, there's really no record kept of what has happened to those ones. And maybe they're the ones used, for QI or something like that. I think we know what human nature is like. I must say, I do have my suspicions.
And I guess there are issues of consent here too, aren't there, in terms of what happens to excess embryos that are produced? Who is it that has the right to say how those can be used?
Yes, I think that issue where many people working in IVF labs honestly just don't think human embryos are anything special. I don't know how carefully that's always watched. Certainly, in Australia, the fine print is that nobody owns an embryo, but you have people who are responsible for them. But I think emotions are so high in those early days. I don't know how carefully people who don't have a high regard for human embryos would really track where they go and who makes that decision. Most people just trust the doctor.
There are a number of related technologies that we don't hear much about these days. I remember there used to be a lot of talk about gamete intrafallopian transfer, where fertilization didn't take place outside the body but inside, or high intravaginal insemination, or NAPRO technology, natural. I'd like to comment on those and their place for questions.
These are gift, for example, is where you put gametes into the fallopian tube rather than transfer an embryo. You transfer gametes and let them get together under their own steam in the fallopian tube. And that avoids the problem of excess embryo creation. Zift is where you put a zygote in the fallopian tube. There were some problems with increases in extrauterine pregnancies with those conditions, but I think just straight IVF is so easily done that I know that in some places gift is still available if people ask for it specifically. But once again, because the people working in the clinic don't see human embryos as being human beings, they really don't go out of their way to create ethical alternatives, because they honestly don't think it's a problem. And that's why I make a point of saying if you do want to protect your embryos, you're going to be seen as a troublemaker, because you're going to want to deviate from the mainstream practice. They have fallen out of popularity. It could be due to the complications of those procedures. But I haven't actually investigated exactly why they've fallen out of popularity, out of favor. But it's big business now, and a lot of IVF clinics in Australia are now run by big business rather than doctors, and maybe they're not cost effective.
Jean Rudd from the US is asking, what are your views on surrogacy, and particularly gestational surrogacy?
So thank you, Jean. With surrogacy, there are variations that can occur for those less familiar with it. You can have surrogacy where the embryo from the intended social parents is created in the laboratory, and an embryo with using their gametes is transferred to a surrogate. Or you can have a surrogate mother where her egg is used and she gets something like intrauterine insemination with the husband's sperm. But the intention is that the social parents are the ones who will take the baby once the baby is born. Look, I think there are huge problems with surrogacy. In some places, it's only allowed on altruistic grounds. In some places, it's commercial. I think we can, commercial surrogacy across the world, particularly in developing countries, has seen great exploitation of women. You know, there are some clinics that will inseminate 4 women at the same time, and if there are extra babies that the parents don't want, they're just aborted. So there's definitely big business in commercial surrogacy that is very problematic. Altruistic surrogacy, generally you're allowed to pay the expenses of the mother, but sometimes it's very difficult to know sort of what's the line between covering costs and then giving someone a reward. So there are definitely women who will do surrogacy because of the money involved. Even though there are some women who say they will carry a child just out of goodwill, most would say, well, I wouldn't do it if I didn't get the money. And there are many problems with surrogacy in that a mother, I've had 2 children. I know the bond you create with your child while your child is growing in your womb is very powerful. I'm very troubled by breaking that maternal-child bond that develops during a pregnancy. And indeed, there have been cases where mothers have refused to hand the child over when it came to the birth. And so the legalities and the legal problems of surrogacy are legend. There are certainly problems there. I also think the Bible teaches that our responsibilities as parents aren't just a matter of providing gametes or providing a womb, it's to raise the child as well. And in the case of surrogacy, once again, the surrogate is usually contracted and not involved in the ongoing care of the child. And I think that is problematic. And there are also there's growing evidence of problems. If it meant, usually a surrogate is encouraged to be someone who's completed her own family, and there's evidence that the children of the surrogate can become quite traumatized when the baby's given to the social parents. The children say, well, she's given away one baby, and am I going to be the next one? So there are lots of problems when you create this artificial situation of someone carrying a child without the intention that they will raise the baby. So I generally am not in favor of surrogacy, but I can see a case where if you had a couple who had excess embryos and through no fault of their own, perhaps during delivery of a child, the uterus is ruptured and a woman who was planning to transfer all her embryos can no longer nurture them herself, that if there was a relation who could sort of have those embryos transferred, so the social parents raise their own child and still have a relationship with the surrogate. You know, I can see how, once again, a retrieval ethic where you're trying to make the best of a bad situation, you could justify an altruistic surrogacy on the grounds that you are saving the lives of those embryos. But I think there are so many problems involved. I think people need to think very carefully before they would countenance that kind of an issue.
Yeah, and I guess it's a huge subject in itself, isn't it? Surrogacy. You started off by talking about, first of all, the pain of infertility, quoting some scriptures, and one thinks of Rachel saying to Jacob, "Give me children or I'll die." You know, it's the desperation in that cry. But also you talked about the wider context, why there's such a demand for IVF, and one of those reasons being the fallen babies available for adoption through both women choosing to keep their babies and also abortion as well. And so often the Christian couple who are infertile may feel that there are no other alternatives than going down the path of IVF. But what alternatives are there for Christian couples who find that they're unable to have their own baby apart from IVF?
In some places, adoption may be possible, but I think there are very few children available for adoption. I think probably the big area would be in foster children. There are many children who, for one reason or another, are no longer able to stay with their birth family. And in most, certainly in Western countries, there are a lot of children who are already born who need a loving home, and what a great blessing it would be to them to be raised in a Christian family. So I think that that's certainly one area where there's great need, and certainly availability of children to raise. I think that sometimes God gives us spiritual children, and that within the church family, I think all children benefit from a relationship with an adult, a Christian adult who is not their parent, who is able to be a wise counsel in ways that parents just can't be. And I've certainly valued those relationships for my children. So that is another role which I think is very important within the church. But I know that these will be viewed as definitely second best options, and that the pain of infertility is certainly something that will remain a great source of pain for people who are unable, who desire their own child and can't have a child of their own.
Sure. Now, you touched on the issue of PGD, pre-implantation genetic diagnosis. And of course, as you said, we've now got the technology to identify a huge number of genetic abnormalities, even at the embryo stage, before the 8-cell stage. To what extent is the destruction or disposal of an embryo with a genetic abnormality, to what extent is that analogous to destroying or not choosing to help a disabled child? Is that a fair analogy? And should we be disposing of embryos with genetic abnormalities?
I would say categorically that the Bible would not support the idea that the disabled are any less made in the image of God as anybody else. So the idea that we will screen embryos for genetic abnormalities and discard those with abnormalities, I think is absolutely abhorrent to a God who has a great heart for the orphan and the widow and those who are very vulnerable in our society. And some people think that discarding embryos is less of a problem than abortion for disability, which is also becoming quite common in Western societies. So I think that it's highly problematic. And the funny thing is, I've been working in genetics for the last 6 years or so, and I think we're just going to get to the stage where we do whole genome sequencing, and we will be saying, well, we've done PGD, and you can have a child that gets cancer, or one that gets heart disease, or one with Parkinson's disease. Take your pick, but none of them are normal. So I think we're creating this bizarre situation where we've got this notion that you can have a normal child, a healthy child, if you do enough tests. But I think we are all genetically scarred, and it's a matter of which disability we will have. And the WHO talks about disability as being on a spectrum, and yes, far more people develop their disability after birth than before birth. So we're having ourselves on if we think we can create a world without disability. But the direction of using PGD is definitely, I think, going in the direction of eugenics.
Yeah, designer babies and all the rest. So, and just finally, because sadly we've run out of time now, but there's a question here. What can we as Christian doctors do who are going to meet infertile couples who are Christians, who are going to be having lots of opportunities to talk or be asked about this issue, even if we're not practicing in this area? What can Christian doctors do in terms of really helping this whole issue and contributing to the debate and trying to be salt and light where we are?
I think in the whole area of conception, our whole society is really heading in the direction of adopting this idea that only normal, healthy children should be allowed to come to birth. And I think that we really need to be advocates for the unborn. I think they're under great threat in our society. We've seen some cases in the United States where insurance companies have refused to pay for the health costs of children who were identified having a disability before birth on grounds that it was a previously known diagnosis and the parents should have aborted, so they're not going to pay for the health costs. So we have this mentality that only healthy children should be born. There's a huge project in Australia called the Mackenzie Mission, where expectant parents or prospective parents are going to have genetic screening to see their carrier status, and that they'll be told their reproductive options, which will be to have PGD or antenatal screening with abortion being offered, so disabled children aren't born. So I think we really need to talk to those around us. I think Christians need to be much more proactive in the disability space. You need to think, how can I support the families in my church with a disabled child? How can I invite that disabled child to my child's birthday parties? Can I do some babysitting? Really do more to help to give more dignity in the way we treat the disabled population and be more inclusive in our churches. And I think we need to in our churches, I mean, we talk about having children in marriage services. We need to start warning people in advance, you may not be able to have children, and that's okay. It's very hard in a church full of family programs to have infertility. So we need to, I think, open up that option of saying some families won't be able to have children, but they are still families. They are still whole families. And I think when it comes to IVF, the take-home message is check the facts before you start. Find out about it before you start. Read the information. Don't just count on the counselling you get when you get to the clinic, because you may well be asked to sign your consent form in the waiting room before you see the doctor. So many of the problems in IVF are only avoided if you see them in advance and take precautions. So yes, forewarned is forearmed.
Yeah. Well, thank you very much. You've been listening to Professor Megan Best on the ethics of in vitro fertilisation today, and some real take-home messages here, taking us right back to the fundamental question of what is the human embryo, not a potential human being, but a human being with potential, that life begins at fertilisation. And that's where we start, just as Christ entered the womb, but especially through all of these things, the importance of thinking them through ahead of time. And as Christian doctors, being able to give a biblically informed and compassionate position on this to those who are agonizing over this whole issue. So otherwise, thank you again to Basker for his electronic wizardry behind the scenes, to our translators, Daniel and Hernda, for making this much more widely accessible, most especially to Professor Megan Best for this account and the way in which you've answered the questions today. And finally, to all of you to coming and making it a success. May God bless you, and hopefully we'll see you next week. Thank you.
Thank you.